Hi everyone, my name is Dr. Ada Zion. I'm a consultant obstetrician gynecologist. I take care of women and their health. I want to thank you for subscribing to my channel. I want to thank you for liking this page. I want to welcome you. If you have not subscribed, please do so. Subscribe and like this page. Thank you so much. We'll be talking about women's health and children's health on this page. Everything that concerns women, pregnancy, till delivery, breastfeeding, puerperium, that is after birth, till old age, and everything about our children. You can feel free to ask your question. I'll try as much as possible to answer them. So let's go on. Pregnancy is God-given. Pregnancy is a gift from God. And I want to congratulate everyone that is pregnant now. Congratulations. You are the window to the world. You replicate and replenish our world. I want to thank you so much. I want to thank those that have also completed their families. Those that have done their work and are resting. Thank you so much. And I want to congratulate in advance as many women that are still hoping to get pregnant. The Lord will do it for you. Soon, you'll have your own babies. I want to thank you so much. Now, let's go straight to what we'll have today. We'll take a preamble about pregnancy. Every topic or every theme I'm going to mention in this video, I'll take them one after the other in subsequent videos. Pregnancy is supposed to be a physiological process. It's supposed to be normal. But for some women, it becomes pathological. That is, becomes a disease. The pregnancy is not meant to be a disease, but it varies from one individual to another. What one experiences may not be what another experiences. Some women experiences more problem with pregnancy than other women. I don't vomit in pregnancy. Some women I take care of vomit so excessively that they will require hospital admission. Now, it is okay. It's just for some time. It's not going to last. Just for 9 months, approximately 40 weeks. So, calm down. Take your time. It will soon be over. Then, I want to talk about some changes that occur in pregnancy. You know, from the time of conception, before you even know that you are already pregnant, some people, the first thing that happens is for you to miss your period. Most women come with, I've missed my period. If you miss that period for consecutively 2 months, be rest assured you are pregnant. After 10 days, for some women, you can do a pregnancy test, both serum, the one you use blood, or urine by buying just a strip, and it shows that you are pregnant. The next thing that may follow is your breast begins to engorge. You start noticing that your breast is big. Now, when you start noticing that your breast is big, it's part of the processes that you will see in this pregnancy. It should not be a source of concern. Your body is preparing you for the baby that is coming. So, congratulations once again. Now, pregnancy is divided into trimesters. 3 different halves, if I will use that word. Each of the trimester is divided into 13 weeks. Now, the first trimester of pregnancy starts from the time of conception till 13 weeks after conception. Then, second trimester starts from 14 weeks till 28 weeks. That 28 weeks, in a layman's term, we used to say 7 months. Now, from 7 months, which is 28 weeks, till delivery, till 40 weeks, is said to be third trimester. Some women can carry pregnancy more than 40 weeks. But if you are seeing an obstetrician, we won't like that pregnancy to exceed 42 weeks. So the pregnancy duration lasts for 40 weeks plus or minus 2 weeks, which is okay. Now, in first trimester of pregnancy, that's where most women experience pregnancy symptoms, those that may not be palatable. Some starts with vomiting. When you are vomiting in pregnancy, it's okay. So far, you replenish whatever you vomit. Some are early morning vomit and maybe once a day. Some go on to vomit excessively that they will need admission. Now, I want to tell you, if you are vomiting and you cannot replenish, please, as much as possible, you need to be admitted. You need to see your obstetrician. There's a lot of things that will be done for you so that you do not go into deficit. Some will go as much as losing weight because of vomiting. My dear, you need to see a doctor. There are some things that tips will give you. It may even require setting up an IV line and trying to give you some micronutrients as well. Some drugs can also help, but that will be at the discretion of your obstetrician. Now, we don't want you to go into deficit. That excessive vomiting that requires admission in pregnancy is called hyperemesis gravidarum. Now, the third that some people may experience is weakness. Remember, your body is trying to adjust to carrying another woman different from you. You are trying to nurture someone else. So it's expected you optimize your nutrition. It's expected that you take adequate fluid, adequate balanced diet. It will help you a lot. If the tiredness becomes severe, you need to see a doctor, because there are some other things that may be happening. Remember, you are feeding for two. You may become anemic. There may be reduced blood volume in your body, which is causing that tiredness. So, but that will be found out in the hospital when you see your doctor. Now, normally for pregnancy, there is what we call increased cardiac output. Your body, your heart tends to pump higher. Your blood volume increases because the body is just trying to compensate to make yourself comfortable with that pregnancy. It's okay. Most times in early pregnancy, you see that your blood pressure comes down. It's normal. It makes the body, it's just body compensatory mechanism to help you carry that pregnancy. There's no problem with that. But in early pregnancy and you are still seeing elevated blood pressure, something is wrong. You need to see the doctor. Maybe you were hypertensive before you got pregnant. So we need to control, because excessive blood pressure in pregnancy will affect your placenta perfusion to that baby, and that baby may become growth restricted. You may not even carry that baby up to viability, which in Nigeria is 28 weeks. It's different for other countries. So it depends on the salvage rate those countries have. Now, the other things that may happen is, remember, especially for the first timers, the placenta is new. For those ones that are getting pregnant for the first time, we call them the primigravida. The placenta is new. So they are prone to having malaria in pregnancy. The next thing they say they have malaria. You have fever, your throat is bitter, and you are weak. You are having, see a doctor. We treat malaria in pregnancy, and the pregnancy continues. Please don't go and start treating yourself. In pregnancy, you are not expected to treat yourself at all. Remember, you may not know the drugs that you will take that will not become a problem to that baby. I know you don't want to give birth to a baby that has the eye on the back. No, God forbid. Now, you want to give a baby as beautiful as you are. So, see a doctor to help you plan it, to help treat you. Some other women will have some other problem that will not even be explained. Some will come with waist pain. If you start having waist pain in early pregnancy, my dear, you need to see a doctor. We want to be sure that that pregnancy is intrauterine, that is in the uterus. We also want to be sure that that pregnancy is not about to be miscarried. Now, let's go further. In early pregnancy, that first trimester I talked about, between a time of conception till 14 weeks of gestation, that is roughly about 3 months. We need to do an ultrasound scan. Ultrasound scan will help you to locate where the pregnancy is. Some pregnancies will stop at the tube, at the fallopian tube of that woman, and it will lead to what we call ectopic pregnancy. It will implant there and start growing. You do a strip pregnancy test, it's positive. And if you do not locate that pregnancy as early as possible for us to find out that it's in the tube, it may rupture. We now come with bleeding per vagina that will lead to surgery that will cause us to remove part of that tube and make that tube incompetent to bring out another baby. So please, First trimester ultrasound is very, very important. Number one, it helps you to date your pregnancy. Peradventure, you don't know the time you missed your period. It will help you also to locate that pregnancy. It will help to tell us the number of fetuses in that pregnancy. What I mean is number of babies you are carrying. Your exacerbated pregnancy symptoms may be because there are more than one baby in that uterus. It will also help us to rule out what we call molar pregnancies, abnormal pregnancies. And it will help us to know whether the pregnancy is growing well with the age, which you think is the age of that pregnancy. For those that know their last menstrual period, when you do early scan, it will help us to date it. In fact, early scan is better for dating than late scan, especially for those that are unsure of their last menstrual period. Thank you so much if you have stayed with me till this period. Let's go on. Now, in second trimester, you start feeling somebody doing you like this. Just flicker of movement round your waist, lower abdomen. You just feel somebody doing, my dear, somebody is saying, hi, mommy, hello, mommy, I love you. It's a beautiful experience. At this period, your baby has become active. And when you register for antenatal, there's something we do. We try to give you an malaria prophylaxis. This malaria prophylaxis will help you not to have malaria in pregnancy. Even if you're going to have it, it's not going to be frequent. And there's durations we'll give this. If we start our second trimester, we'll give every 4 weeks. We give this prophylaxis every 4 weeks. It helps you to have a beautiful pregnancy journey. Now, we'll continue to monitor your pregnancy. If you have any symptom, at this period, for some women, the exacerbated pregnancy symptom like vomiting in pregnancy begins to wane, begins to go down, and your stomach begins to come out. Everybody begins to see that you are pregnant. It's a beautiful thing to behold. Now, you don't need to start wearing tight gown. We want you to give that baby freedom. Wear a beautiful clothes, but not too tight. If you're going to wear a trouser, please don't wear the one that will tighten you so much. This is not time to start wearing gido. You notice that maybe you start growing big. Please don't starve yourself. Eat optimally. When you give birth, you will lose weight. You will do whatever you want to do. But for now, remember you are feeding for two. Eat. You don't need to eat marathon. You don't need to eat big plates. Just eat to your satisfaction and eat balanced diet. It's very necessary. When you start in first trimester, I forgot to mention, you have to start taking your folic acid. That folic acid helps that baby to develop normally. There's something we call the neural tube. The neural tube will form well and fuse well. You will not have spinal bifida. You will not have any problem with brain development. You will not have any problem with the cord development. You know that small yellow drug is very, very important. Even if you're not going to take any other one in first trimester, make sure that immediately you miss your period, you start taking that yellow drug. Some even start taking it preconceptionally so that everything will fall in places, in pleasant places, just like the scripture says. Thank you so much. So let's go on. Second trimester, we start seeing your doctor. We'll continue with your drug. Among the drugs we give you the yellow drug, the folic acid, the fesolate. These are the hematinics. We can add vitamin C to help absorption. We can add calcium if you start complaining of some bone, because some women will start complaining about their bones. The bones, they are having bone pain, wrist pain, carpal tunnel syndrome, all those type of things. So we'll try to help you. Then we'll start giving you anti-malaria, that is malaria prophylaxis. We use sulfadoxine pyrimethamine mostly. We'll give you 4 weekly. You're supposed to take it 4 weekly apart. At least 3 doses. 3 doses. Some women will come and tell me, Doc, I've taken 3. Is enough? I say no. The recommendation is at least 3 doses. you take till delivery. Initially we used to stop at 36 weeks, but the recommendation now is that you take till delivery. We don't want you to come down with malaria. You are expected to sleep under insecticide treated nets. Please don't expose yourself. If you think that the place, your environment is hot,